Hello, I'm Dr. Atwa, and I'd like to talk to you about the journey to the new you. I'm going to go over several slides to explain to you the procedure of your journey to the new you with weight loss surgery.
Bariatric surgery. You probably think it's an extreme solution for people who end up on TV shows like My 600-Pound Life, right? Did you know the typical bariatric surgery patient is a woman between the ages of 35 and 50 and is about 100 pounds overweight? Not extreme at all. Take Sarah, for example. She's a 45-year-old wife and mom of 3 kids. She's 5'5" and weighs 245 pounds. That means her body mass index, or BMI, is 41. That's too high. In fact, anyone with a BMI over 30 has the disease of obesity. Sarah's parents were heavy, and she has always been bigger than her friends. But in the last few years, she has steadily gained weight despite her best efforts. Oh, by the way, she takes medicine for high blood pressure, was just diagnosed with sleep apnea, and her doctor told her she has pre-diabetes. She goes to the gym 2 or 3 times a week and eats a pretty healthy diet. But her weight is now out of control. Sarah wants to be slimmer, but like most Americans, she thinks it's a willpower problem. She has always quietly fought this battle on her own, but is now at her wit's end. The straw that broke the camel's back was when she was too big to get on the roller coaster last summer with her kids. What Sarah doesn't know is that in addition to the frustration she feels about her weight, obesity has put her on a path towards heart disease, type 2 diabetes, and many other life-threatening chronic diseases. Most people think of obesity as a defect of character. People with obesity are often looked at as lazy and undisciplined. That's not the case for other chronic diseases, though, and it shouldn't be the case for obesity. Like cancer or heart disease, obesity is a combination of environment, genetic, and lifestyle factors, and left untreated, it's deadly. Sarah doesn't want to drag her feet until she develops diabetes, has a stroke or heart attack, or worse. So she takes action and asks her doctor to help her find effective treatment. Once she realizes how much her weight is putting her health and future at risk, she considers having bariatric surgery. Sarah's bariatric surgery team talks to her about 2 options: sleeve gastrectomy and gastric bypass. Both procedures decrease hunger and improve feelings of fullness when eating by decreasing stomach size, changing hormones released by the gut, and altering the way Sarah's stomach talks to her brain. Unlike dieting, Sarah's body won't fight back when she rapidly loses weight after bariatric surgery. Over time, her body will find a much lower and a much healthier set point for her weight that she can maintain. After talking with her surgeon, Sarah chooses to have a sleeve gastrectomy. The surgery is done laparoscopically with a few small incisions, takes about an hour to complete, and she spends 1 night in the hospital before starting her new life. 1 year after surgery, Sarah has lost 90 pounds. She no longer takes blood pressure medicine or uses her CPAP device, and her blood sugar is normal. She feels great and still exercises 3 times a week, but can do a lot more in the gym now. She still eats a healthy diet, but her portions are smaller than before. She knows she has to work hard to maintain her weight now, but she has the tools to do it. Most importantly, she has tons of energy to play with her kids and is back to riding that roller coaster. While there are extreme examples of obesity on TV shows, most bariatric surgery patients are a lot like you or someone you know. Regular people who have struggled with their weight for too long. There is safe and effective treatment for obesity, and it's not extreme. Join the 200,000 Americans who take control of their health each year by undergoing bariatric surgery. Obesity can be effectively treated, but you have to ask for help.
So this is my team. I'd like to introduce them to you. I'll go over each doctor. This is myself. I did my residency in Chicago, fellowship in laparoscopy in Houston. I did some training in bariatric surgery. I've been in private practice for about 20 years, performed over 10,000 cases, and assisted other surgeons on 6,000 cases, both general, laparoscopic, bariatric, and robotic surgery. Currently, I'm the Director-in-Chief of Surgery at St. Charles Hospital, and I'm the Chief of Robotic Surgery. I'm also the chief of surgery at Mather Northwell Hospital, as well as the chief of surgery of St. Catherine Hospital. My partner, Dr. Leung, he did his fellowship in bariatric surgery at Staten Island University. Dr. Kerr also did his residency at the Metropolitan Group in Chicago, and then he did his fellowship in bariatric surgery in St. Agnes Hospital in Baltimore. Dr. Barr, she does medical weight loss in our practice. She was the previous president of the medical staff at Mather Hospital. Dr. Craig graduated from San Rafael residency program in Yale, and he's been in private practice. He was also the past president of the medical staff at Mather Hospital. Leslie is our nutritionist. She'll talk to you before and after surgery to go over the nutritional guidelines. They'll give you advice on how to eat healthy. Tony Ann is our bariatric coordinator, and she's assisted with Joni that would help you, guide you through the steps that you have to undergo before your and after your bariatric surgery journey. This is a free app that you can download, Baritastic. We'll give you the code for our practice, and it has a lot of helpful tools about certain recipes and how to track your weight, and give you some reminders about drinking water and eating a certain amount of protein. So today what you're going to learn about is what is obesity? What are your daily challenges? What is obesity costing you? And what are your options? And what are your next steps to become healthy? So the first definition is, what is obesity? Obesity is a disease, just like diabetes and cancer is a disease. It's a disease where there's extra fat and other associated diseases known as comorbidities. There are a lot of factors that cause obesity. It's progressive, it's life-threatening, and it's very costly. What is morbid obesity? Morbid obesity, you're considered to be clinically severely morbidly obese when you're about 200% of your ideal weight, or on average about 80 to 100 pounds overweight, which means a body mass index of more than 35 with a comorbidity, or a BMI of more than 30 with one of the comorbidities. There's a wide range of the BMI. The normal range of BMI is 18.5 to 25. You're overweight when you're above 25, obese when you're above 30. Severe obesity is a BMI more than 35. Morbid obesity is above 40, and super morbid obese is when you're above 50. Who qualifies for surgery? It's when you're obese, which means a BMI more than 30 with a comorbidity, like high blood pressure, diabetes, or severely obese without a comorbidity. Now, there is a risk to your psychological and social well-being when you're obese. There's something called the cycle of obesity. When you're obese, you have a negative self-image. You begin to, you're exposed to social isolation, and you start to eat to feel good, and you get to this vicious cycle. Now, it affects almost every part of your life. When you're obese, you have a shorter life expectancy, you have a lower quality of life, and you have a lot of severe life disadvantages. And there are many factors that cause it, almost about 50 factors that cause obesity. Number one is genetic. If your parents or grandparents are obese, you'll be obese also. Sometimes certain medications can increase your appetite and make you become obese. When you go out to eat, there's a lot of unhealthy options on the menu. And the last cause of obesity is some people eat when they're stressed or sad or depressed, but that's not the main cause. And that's what most people say. They say, it's my fault that I'm overweight. And I tell them it's not your fault. It's just like nobody ever blames himself for diabetes or cancer. It's a medical problem, and there's treatment for it. A lot of medical problems can be caused by being obese or overweight. Diabetes, high blood pressure, high cholesterol, certain lung problems such as sleep apnea or asthma, depression, irregular menses, stress incontinence, where people cough or sneeze or laugh and they have some urine leakage. There are about 13 cancers that are caused or increased by being overweight. Obese patients also have a lot of reflux or GERD. You can have some arthritis, back pain, knee pain. There are certain heart diseases, heart failure, atrial fibrillation, high risk of heart attacks, a fatty liver and cirrhosis, stroke. They also recently found that the number one cause of dementia and Alzheimer's is being overweight. infertility, and they also found that 70% of patients that were sick, that were in the hospital with COVID, were overweight and obese. So as you can see, obesity affects almost every organ in your body, from the brain, where there's high pressure in the brain, higher stroke rates, cataracts, heart attacks, diabetes, high cholesterol, hypertension. Just those three medical problems alone called the metabolic syndrome. 13 cancers are increased because of obesity. Lung problems, fatty liver, where you get steatosis or steatohepatitis or cirrhosis, polycystic ovary disease, osteoarthritis, and gout. So you're not alone. It's an epidemic. About 69% of adults now are overweight or obese. A third of children are overweight. About 5% of adults in the United States are morbidly obese and they qualify for surgery. Total medical cost for obesity in 2022 was $173 billion. Every year, almost about 325,000 people die directly because of obesity. Around the world, several million people die because of obesity. So it's almost like a 9/11 every 3 days, which is incredible. And as you look at the trends of obesity, if you look at 1990, the majority of the states were around 10 to 15%. Now in 2018, and every year this gets worse. It's about 30%, and every year they map this, it gets worse and worse. And it's the same throughout the world. The problem with obesity is you face a lot of obstacles every simple things, as going up the stairs, getting into a plane with a seatbelt, going to the movie theater, simple things like tying your shoelaces. And a high BMI affects your life expectancy. Like I said, normal BMI is between 18 to 25. As your weight goes up, so does your death rate. And also all the comorbidities that occur with obesity go up as your weight goes up. So does the rate of diabetes, asthma, arthritis, high blood pressure, and cancer goes up also. And these are some facts about obesity. It's the number one cause of preventable disease. It used to be smoking, now it's obesity. 50% of cancer deaths in women are caused by obesity, 30% in men. Most diabetes now in the United States is caused by obesity, and there's a new epidemic called diabesity, where you're diabetic and obese. Sleep apnea is caused by obesity. Most heart attacks and cardiovascular disease is caused by this, as well as high blood pressure. 400,000 deaths a year by obesity or from the other diseases that are caused by obesity. And on average, morbidly obese patients die about 10 to 12 years younger because of their weight. The good news is when you lose about 50 to 70% of your extra weight, a lot of these problems resolve. Your quality of life improves about 95%. Your death rate goes down by about 90%. Migraines and high pressure in your brain goes down, resolves in about 57%. Depression improves. Obstructive sleep apnea, the metabolic syndrome improves. So you can see all these problems resolve. And the earlier you treat this problem, the quicker the medical problems resolve. And if you look at the different options of weight loss, in the past, people who try to diet, they lose 10, 20 pounds and they gain it back again. It's called a yo-yo diet, and you feel bad afterwards. The success rate with dieting is only about 0.05%. Exercise, you may lose a few pounds, but it's hard to lose about 80 to 100 pounds with exercise alone. Behavior modification might work for a while, but then it'll regain the weight again. Drug treatment is helpful for about 10 to 15% of weight loss. But the best option and most successful long-term treatment of morbid obesity is weight loss surgery and lifestyle change. And again, if you compare the different treatment options, lifestyle and medication is about 10% weight loss. The lap band was about 50%, sleeves about 55 to 60%, and the bypass 65 to 70%. Now, why are we obese now? If you look 20 years ago, people would go out for a muffin and some coffee. It would be 250 calories. Now you go to Starbucks, you get a muffin, 500, 600 calories, and a Frappuccino is about anywhere from 350 to 500 calories. So that's about 1,000 calories, and there's no nutrition. It's pure sugar. Who owns Jenny Craig? Nestle owns them. You know, and they also own other things like candy bars and Haagen-Dazs, and they also own the OptiFast, which helps you lose weight. So Nestle, you know, if you want to lose weight, they'll help you with Jenny Craig and OptiFast. If you want to gain weight, they have all this candy and unhealthy stuff. Problem is there's lack of exercise also. This is this gentleman's idea of exercise by walking the dog. This is a gym. It's open 24 hours, but they have escalators going to the gym. So instead of taking the steps, they have escalators to make it easy for you to go to the gym. Now, who qualifies for weight loss? The ASMBS, our Society for Bariatric and Metabolic Surgery, recently brought down the indications. If your BMI is more than 30 with a medical problem such as diabetes, high blood pressure, or high cholesterol, you would qualify for surgery. Or if your BMI is more than 35 without a need for the medical problems, or if you have it also. You have to be healthy enough to undergo the operation. Sometimes some insurance will require you to show that you've tried to lose weight in the past. We have to make sure that you're not on any drug or alcohol addiction issues going on currently. No uncontrolled psychological problems. And you're seen by several doctors, a pulmonologist, a heart doctor, nutritionist, psychiatrist, and they all agree that you're a good candidate for the surgery. You also have to understand the risk of the surgery and the indications and options for it. But the most important thing is you have to be dedicated to a lifestyle change and follow-up. Common reasons why people want to seek weight loss surgery: they want to cut down the number of medications or eliminate them completely. They want to improve their health and quality of life. They want to have more energy. They want to look better. They want to be more mobile. They want to get down to a certain weight or size. They want to live long enough to see their children, grandchildren grow, and they want to feel better about themselves. Now, is bariatric surgery a safe option? If you compare weight loss surgery to laparoscopic cholecystectomy, which is gallbladder surgery, we do that every day, to hip replacement, to bypassing the heart, the safest out of all these operations is the bariatric surgery. And the reason for that is you're seen by a heart doctor, a lung doctor, a nutrition psychiatrist. So we make sure that you're in the best condition before you go to surgery. And what you should be afraid of is not getting the surgery. This is the, if you look at weight loss surgery, this is the death rate of patients that don't undergo the surgery, about 6.2%. And people that undergo the surgery, it's actually a lot safer now. It's less than 0.1%. Same with heart surgery. People that have heart disease and they don't undergo heart surgery, their death rate is about 17%. And when they undergo it, it's around 8%, even safer than that right now. So what are the options for weight loss surgery? In the past, they used to make this big cut and you'd be in the hospital for a week, take you 6 to 8 weeks to recover. There's high risk of infections and hernias. We don't do that anymore. We do it with a small little incision with the robot. It's very precise, tiny little incision. When they heal, you don't even see the scars. You're sore for the first day or two and you're back to yourself within 7 to 10 days. These are some of the problems that can happen with any kind of abdominal surgery, like bleeding or pain, pneumonia, some complications from anesthesia or blood clots, but all these are extremely rare. These are the different options. In the United States, about 250,000 cases performed. The lap band is not performed anymore. It's most of the time we're taking it out. It's less than 1%. Most common operation is the sleeve gastrectomy, about 61%, and then the bypass is around 20%. We also perform revisional surgery for people that have gained some weight or have had some issues with their previous operations, about 10 to 15%. And we also perform the gastric balloon in about 2%. The sleeve is the most common operation. It's the safest, quickest. It's most of the time it's done with a robot now. And you lose about 60% of your extra weight, roughly about a third of your weight within the first year. There's no devices, no foreign body. The stomach is the shape of a pineapple. And we go with a small little incision. We take out about 80% of your stomach. And you're left with this small little tube here. It looks like a banana. So what happens, you take a few bites, you feel like you're full. This part of the stomach that we take out makes a hormone called ghrelin. The ghrelin stimulates and increases your appetite. So when we take it out, you're not hungry anymore. You actually have to remind yourself, and that's how it works, and that's how it's more successful.
To access the abdominal cavity, small incisions are created. Trocars are placed to serve as passageways for surgical instruments. The surgeon examines the abdomen using a laparoscope or video camera. The average human stomach can expand to hold around 1 to 1.5 liters of food. While in the stomach, food is combined with digestive enzymes. These help break the food down into a simpler form so that it can be digested more easily and absorbed in the small bowel. During a sleeve gastrectomy, a thin vertical sleeve is created by using a stapling device. This sleeve will typically hold between 50 and 150 milliliters and is about the size of a banana. The resected portion of the stomach is removed. By altering the anatomy of the gastrointestinal tract, sleeve gastrectomy changes signals in the body. resulting in decreased hunger and increased feelings of fullness after meals. Bile and pancreatic fluid from the liver and pancreas mix with food and allow it to be completely digested and absorbed in the bowel. There is no rerouting of the small bowel or postoperative adjustments needed for the sleeve gastrectomy.
So these are some of the problems that can happen with the sleeve. That's with any operation. Extremely rare for hernias. Sometimes when you lose weight, you can get gallstones, but we give you some medication to prevent that. Extremely rare for wound infections to happen because it's small incisions. There can be some weight regain. Blood clots, we make sure that you get up and walk around. We give you blood thinners. There can be some nausea, which is extremely rare these days. These are some celebrities that have had weight loss surgery. This is Graham Elliott. He had a sleeve. This is Rosie O'Donnell. This is Mariah Carey. And this is one of our patients. This is another one of our patients. You see most of the patients, whether celebrities or not, they look great afterwards. Some of them look like supermodels. And I tell everybody, you're going to look great, but that's not the main reason we're doing this operation. We're doing the operation so you can live a longer, healthier life. So you don't have the problems with the diabetes, with cancer, with strokes, with COVID, with dementia. All these problems are resolved after the weight loss surgery. There's another patient, and all she wanted to do was to play with her grandkids. And she's able to do that. She lost 73 pounds, and she feels great. The second option is the bypass. There are two types. There's the formal bypass and the mini bypass. And with this, we staple across the upper part of the stomach, and then we hook up the intestine to that. And there's another connection down here with the regular bypass. With the mini bypass, there's only one connection.
Small incisions are created for placement of trocars, which provide access to the abdominal cavity and serve as passageways for surgical instruments. The surgeon examines the abdomen using a laparoscope. The average human stomach can expand to hold around 1 to 1.5 liters of food. While in the stomach, food is broken down when combined with digestive enzymes, so its nutrients can be absorbed in the small bowel. During a 1 anastomosis gastric bypass, a surgical stapler is used to create a pouch at the top of the stomach. The small pouch, about the size of a small banana, limits the amount of food you can eat before feeling full. Next, a 150 centimeter to 200 centimeter segment of small bowel to be bypassed is measured off. A loop is brought up and connected to the newly created pouch through a sutured or stapled connection called an anastomosis. Bile and digestive fluids from the liver and pancreas allow food to be digested completely. By altering the anatomy of the gastrointestinal tract, gastric bypass changes metabolic processes and signals in the body, resulting in decreased hunger and increased feelings of fullness after meals. Compared to a traditional gastric bypass, the 1 anastomosis gastric bypass is typically a shorter and simpler procedure that involves a slightly larger stomach pouch and may require less mobilization and manipulation of the small bowel. And unlike traditional gastric bypass procedure with 2 anastomoses, it requires the creation of only one.
So again, here's the normal anatomy. This is your esophagus, that's the stomach, and here's your intestine. That's how food goes through. After the bypass, they have a little pouch. Take a few bites, you feel full. The food goes through the intestine, but there's no absorption since there's no acid or bile to break down the food. Once the food comes to this part, the acid and the bile and pancreatic juice mixes up with the food, and then that's when the absorption starts. So you have 2 mechanisms of weight loss. So these are some problems that can happen with the bypass. Extremely rare. You get something called dumping syndrome. If you drink anything that has a lot of sugar, like soda, or eat something that has high carbs, give you some cramps and sweating, and you might feel lightheaded. It's very important to take vitamins after any bariatric procedure. And all these complications are extremely rare. These are some celebrities and patients that have had the surgery. This is R. Jones. This is Al Roker. Randy Jackson. And this is one of my patients. He was a truck driver who was having a hard time driving and carrying heavy stuff. And afterwards, he was jumping up and down. And he was diabetic also, and his diabetes got better right away. Revisional surgery. This happens when you regain weight. It happens about 10 to 15% of our patients. And before we jump into a revisional surgery, first we make sure that you're doing everything right, that you're eating healthy. So you talk to the nutritionist. We make sure that you're exercising. We get some X-rays and an endoscopy and see how what's going on. Why did this operation fail? Is it because something wrong with the operation, or is it something wrong with all the things that you have to do? We try the simplest things first, as this diet and exercise, to get you back on track. We can have you see Dr. Barr for a consultation to see if you're a candidate for medical weight loss. That might help you lose some of that weight you've gained back. And if all that is done and it's still not successful, then we look at revisional surgery. So the options, if you've had the band that can be removed, converted to a sleeve or a bypass. If you've had the sleeve, there are a few options. One is if the sleeve is bigger, you can re-sleeve it. If the sleeve is normal size, or if you have a lot of reflux, you may undergo a bypass or a mini bypass if it's the weight regain. If you've had a bypass in the past, we can try a lengthening or a distalization procedure where we move the intestine a little bit further down to increase the malabsorption. So there are a lot of options, and we'll discuss that when we talk to each other. This is one of my patients. She had the lap band. It was removed, and we converted her to a sleeve, and she looks great here afterwards. This is another patient. She had also a band, and this was converted to a bypass, and she's lost about 122 pounds. And this is her after. This is before the surgery, and this is afterwards. And if you look at her, I mean, she's very successful. She looks great afterwards. And the reason for that is she goes to the gym for an hour every day, almost about 5 to 7 times a week. She has a six-pack now. It's incredible. This is Dr. Barr. She does medical weight loss for patients that don't qualify for surgery or don't want surgery, or patients that have gained some weight after the surgery and they need some extra help. So there are different options for weight loss. There are pills, shots, and meal replacements.
Orbera is a non-surgical weight loss system designed to achieve meaningful long-term weight loss. The Orbera balloon is a soft, expandable balloon that is placed in an outpatient setting. During a short procedure, the patient is comfortably sedated as a highly trained Orbera physician inserts the uninflated balloon through the mouth using a flexible camera. Once the balloon is placed in the stomach, it is inflated until the approximate size of a grapefruit with sterile water called saline. The balloon remains in the stomach where it takes up space, slows the digestion of food, and encourages proper portion control. After 6 months, it is deflated and removed in a similar manner. Orbera provides an effective non-surgical weight loss solution for those that have struggled to lose weight. Orbera is the #1 global leading weight loss balloon and is used in over 80 countries. Orbera has been shown to amplify patients' weight loss efforts and lose 3 times the weight of diet and exercise alone. To learn more about Orbera or to find a specialist near you, visit orbera.com.
So the balloon is a great option for people that, or for patients that don't want weight loss surgery, don't qualify for the weight loss surgery. The balloon, we put it endoscopically in the stomach. It stays there for about 6 months. You feel full. The average weight loss is about 30 to 50 pounds. And sometimes we'll add medical weight loss to that even after the balloon comes out or during its placement. So you have to look and see what are the different options for weight loss. Placebo has minimal effect. You can try diet, but success rate's only 1.5% after 10 years. Drug therapy helps with about 10%. Between the sleeve and the bypass, 60 to 100% will remain successful after. The success rate is about 90 to 95%. The weight loss with the bypass is about 65 to 85%, and with the sleeve is about 60%. So which procedure, you want to think long-term, which fits into your lifestyle. Don't base the procedure on what you hear on the internet or from friends or family members. You have to see what lifestyle changes you're willing to make in order to be successful and healthy for the rest of your life. And surgery can help you change your life. It helps improve or resolve most of these medical problems that cuts your life. It increases your lifespan. It helps cut down on the risk and on the cost of medications. And it's just a tool. It's not a silver bullet. Because you hear about people that undergo surgery and they gain the weight back. It's because they're not eating healthy and they're not exercising. The most critical thing is the exercise portion. And as you can see from this graph here, the majority of the medical problems either resolve or get better. And these are the steps you have to take to become successful with your journey. You've completed this seminar. We'll talk to your medical doctor about getting the clearance for surgery. We'll sit down and see which is the best option for you. You'll see the psychologist or psychiatrist to see if you're cleared. The nutritionist will go over your diet. We'll have somebody in our office verify your insurance, which the majority of insurance companies now allow bariatric surgery. We do some tests beforehand to make sure that your vitamin and hormone levels are okay. We do an ultrasound look at the liver, and we do an endoscopy to make sure you don't have a hiatal hernia or ulcers or any other problem that would prevent surgery. You're seen by the lung doctor, the heart doctor. If you're diabetic, you may have to see an endocrinologist. Before surgery, we encourage you to lose some weight. It makes the operation easier. And you undergo the surgery, and follow-up is performed afterwards. You're in the hospital anywhere from 6 to 24 hours. I've had a few patients go home the same day. Most people spend the night and go home the next day. It's rare that you spend more time than that. We get an x-ray the next day, make sure everything is okay. We start you on some liquids, advance your diet. The most important thing is I want you to get up and walk around. We'll put some boots on your legs to massage them and give you heparin shots so you don't get a blood clot. And follow-up, we see you 1 to 2 weeks after the surgery. The band we don't do anymore. As regards to the bypass and sleeve, the first year you're seen every 3 months, and then it's once a year after that to make sure that you're on track, and we check your vitamin and hormone levels, make sure everything is okay. Afterwards, your diet, you want to eat small portions, low calories, high protein. You want to avoid liquids with meals. Exercise, this is the most critical thing. Most of the people that you saw before, they're in the gym for an hour every day. And so you lose weight by eating healthy and undergoing a procedure. You keep the weight off with exercise. And we want to do 1 hour 5 times a week. Half an hour cardio and half an hour weights. And I know sometimes people say, I'm busy, I can't do this. What I do, if you're busy during the week, then on the weekend, try to do 2 and 3 hours just to get that 5 hours. And that should be for everybody, not just for weight maintenance. These are some apps if you're not able to make it to the gym. There's Fitness Blender, there's Sworkit, there's Beachbody. But the gyms are not very expensive right now, anywhere from $10 to $30 a month. And it's just an investment in your health. Your health is the most critical thing in your life. Things to avoid after the surgery: you want to avoid smoking because you can get ulcers. You want to avoid Motrin and aspirin that can cause an ulcer or bleeding. You want to avoid alcohol because it has a lot of empty calories, and after the weight loss surgery, a few sips can get you very drunk. You want to avoid not calling your surgeon if there's any problem with pain or vomiting or any weight regain. You want to avoid, for females, getting pregnant 18 months after the surgery because as you're losing the weight, it'll affect the baby. But after that, you'll actually have healthier babies with your normal weight. And also, it's very important to take your vitamin supplements. The cost is about $15 to $25, but there can be issues if you don't take the vitamins. So surgery is the most effective treatment for sustained weight loss and resolution of your health. Helps avoid all these other problems with morbid obesity. And it's only a tool, but it is that great tool that helps you lose that 80 to 100 pounds in order to maintain a healthy lifestyle. Most people and patients do very well after the surgery. And success or failure is really up to both of us. We work as a team. We work together. If you're falling back or anything is happening, that's why they do the follow-up to make sure that you're on track. Most of the patients, when you ask them what got better after the surgery, every of them said everything is better. I should have done this a long time ago. I sleep better. I have more energy. My quality of life is better. I'm off diabetes medications. My blood pressure is under control. My cholesterol level is lower. I'm not using the CPAP machine. I'm able to move around. So everything in their life gets better. And if there's any questions, we'll go over it. Call my office. We'll set up a consultation or a telehealth if you live far away, and we'll see what is the best options for you. Thank you.